On this episode of the Ask Mike Reinold Show, we have another great baseball-related episode. We talk about the correlation between lumbar spine, thoracic spine, and even some hip issues and shoulder and arm injuries. We talk about strength training in baseball. And lastly, we discuss the concept of transient neurogenic fatigue. The Ask Mike Reinold Show. Helping people feel better, move better, and perform better. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. We're up at Champion PT and Performance up in Boston, Massachusetts. We got another great baseball-related episode. I know this is Dan's favorite.
I love baseball.
Dave,
I'm really good at baseball too.
We're I don't know. We'll see. We'll see. We'll get some more involvement in here. I think it's going to be good. But we're here again. Lenny Macrina, LennyMacrina.com. Dan Pope, Fitness Pain Free. MikeScaduto.com. Right?
Every time.
It is, right? It's MikeScaduto.com.
Yeah.
I don't know. Sometimes I want to say MikeScadutoDBT.com. That's your Instagram. I gotcha.
Should probably change that.
I get Mike's one of the millennials that's not even on Twitter, right? Shunning it.
I'm not on Twitter. Yeah.
Just shunning it, which is good for you. Good for you. I hate Twitter. But anyway, sorry if you got to this on Twitter. But anyway, we had a new student here today we wanted to introduce to the crowd, Drew Dudek from Belmont University. University, right?
Yes.
Yeah, so Drew, we're working on his nickname. So Dudek, it's like the dude. We had the dude for a little bit. I'm a pretty huge Big Lebowski fan, so we just call you the dude. But anybody have any ideas?
No.
Got some weird ones.
Yeah.
Dodecahedron.
Dodecahedron.
Droopy dooby doo.
Ooh, Drooby Dooby Doo.
Yeah.
I say we go with that one.
All right, we're starting off slow. But anyway, Drew's here. He's from Belmont University. It's the University of Belmont. It's Belmont University. We gotta get like a list of all like the universities and stuff. But Belmont, great program. Drew's doing a great job so far. This is like the first time I've ever complimented a student on camera. That's
Before he's
or
even
in person.
Before he's even spoken.
Before he's even said anything. But Belmont University, the home of legendary Mike Voigt. So he's had a good education. But Drew, take it away. What is the first question for today's episode?
All right, so we have Shannon from Kent, Washington. In baseball pitchers, do you often see correlations between range of motion and stability dysfunction in hip and thoracic spine rotation, contributing to shoulder overuse injuries? Do you think this piece is often overlooked in shoulder rehab for these patients?
Drew's a little nervous.
Drew and I are roommates. Insider look here, and Drew was practicing reading random questions off the internet to the crowd last night, sitting around watching TV.
Trying to get it in there. All right, so good question, Lenny. I think you've done some research on this.
I completely don't know what the question
is. Let me rephrase it. I feel like I always rephrase it anyway. So the question is, what's the correlation, or have we found a correlation between hip and spine range of motion and like shoulder elbow pathologies in baseball? Because man, that is hot, right? Everybody wants to say that like there's so much correlation, and there's a ton of theories about how that's correlated and sort of stuff. Len, you've done a little research. What did you guys find?
Found stuff on the shoulder, definitely, and we talked about that pretty much a ton of stuff. But hip, we put a study out in AJSM that showed that they were symmetrical in the hip active range of motion. We didn't really do anything correlating it to injury, if I recall. There are some things on like balance and like neuromuscular control, single leg balance, looking over a season that showed if they don't have good single leg stance pre-season, then it correlated to higher injury rate during the season. That study came out maybe within the year or two. Off the top of my head, without knowing what these questions are, I don't know.
That's how we like it. We like to try to keep it up. Everybody's been trying to search for this, right? Trying to correlate hip range of motion and shoulder injuries is like a big thing that we kind of see in there. And there's definitely some interesting issues that are out there. I think one of the biggest flaws of every study when it comes down to this is that they just group all the pitchers together and they don't delineate between righties and lefties. Because I think our range of motion, not only in the arms, but also in the hips, is different between righties and lefties. So it kind of like balances out the means a little bit and makes this a little bit worthless. But I think to date, there has not been good quality evidence that shows any limitations in hip range of motion correlates to injury. And I think it's very similar for the spine. So theoretically, we talk about this, right? We talk about it in every sport, right? In golf, if your hips are tight, you're probably going to rotate more with your spine, right? And maybe vice versa, right? Thoracic spine has so many issues with overhead stuff like pressing and everything like that. So are there some theoretical things? Yes, but I just don't think it's been shown in the research. I actually think it's a bit overplayed, theoretically. So look, I've done physicals and spring training for 20 years now almost, where we've looked at all these ball players at the beginning of seasons and then throughout the year and stuff like that. We measured hip range of motion for years and couldn't find anything with it for years that I've essentially just stopped looking at. Now I look at it on the table.
That's
but,
good for me then. That I didn't miss something. I was like, did I miss something obvious?
I'm not seeing it. The theories are still there. I believe in the theories. I would address a limitation in hip range of motion if I saw it, but I don't think it's there.
Right.
Just I guess the question is how in the studies how are you measuring hip range of motion? Is it open chain like supine at 90 degrees of flexion, or are we looking at?
There was one that just came out by I think it was
Great
Camp out in Mayo, and he measured in supine. We measured ours in prone, which we thought was better to stabilize the pelvis. We actually had somebody stabilizing the pelvis versus just the table stabilizing the pelvis. So check out that Camp study. I think it was an AJSM, like literally within the past 6 months. Camp et al. AJSM. So.
Right. And others have done seated, right? So
I mean, seated too. Yeah.
Again, so there's differences in methodology. Good point, Mike. But I honestly think if you don't delineate lefties and righties, the research is useless. I think it's irrelevant.
Right.
So it's not out there yet. I would like to see the next study that comes out. Hopefully we take all the righties out or the lefties out or whatever it may be. I think that's a really important thing in terms of the methodology for these things.
Yep.
So I don't think it's there. That doesn't mean I wouldn't research it yet, but everybody wants to say it's like fact. And it isn't right now. I think it's still theory. I guess that's
if you look at a righty versus a lefty shoulder, they're completely different. So it makes sense that the hips would probably be.
Definitely. Hips are definitely different. Our internal organs are different. Our thoraxes are different. So our pelvis is different. It just, it just makes sense.
Yep.
Right? So awesome. All right. Drew Dudek.
I'll try to stay focused on this next question.
All right, this is from the OG Benny Baseball from Fayetteville, Arkansas.
OG Benny Baseball?
Love it. Love it.
Why do you think strength training in baseball is so far behind other sports?
All right, so that's a good question. OG from where?
Fayetteville, Arkansas.
Fayetteville, Arkansas. So why do you think baseball is strength training so far behind other sports? It's an interesting question because I think you could argue it's not. It's just being performed poorly in lots of places.
Yeah, I would say a lot of times we see baseball players who've just been given a football strength and conditioning program. I think there are great programs designed for baseball players that are just not being used more broadly, I guess.
That's a good point. I feel like in college, in a lot of colleges, and I don't want to say this is for everybody because that's not a fair statement. I'll be the first to admit that, but in colleges, I feel like a lot of strength coaches are predominantly football based and the programs are football based, and then the baseball team just kind of gets it, right? They just get that program, right? And it's not a baseball specific one, but there's a bunch of colleges out there now, and even private facilities like us here at Champion and Eric Cressy and there's tons. Ben Fairchild's got a great one down in Texas. I mean, there's so many. I could list so many different places that specialize in baseball. You have to have a unique understanding of the sport and what the body needs to get done, right? So baseball is a very rotational, linear, power-driven sport where the others aren't, right? If you're basketball, you're going to be working on probably, vertical and agility, right? And if you're baseball, you're going to be working on linear and rotational type stuff. So I wouldn't say that I think the programs are bad. I just think there's a lot of generic programs out there, like Mike said. I don't know. Any other thoughts?
I think it's also protecting. Baseball players tend to be a little on the loose side. Football players, our linemen not so loosey-goosey, so you got to respect that as well. They have some hypermobility that you need to respect, and some of the positions that we may put them in may put that joint in a bad position that they're not able to stabilize. These guys are loosey type guys that get weight, a ton of layback. So I think you got to respect that as well. So we see that a lot. The kids are doing some high level Olympic lifting, and we just got to modify their program a little. I don't mind it. We just got to modify some of the catches and stuff like that.
Yeah, I think the way we do it here at Champions, we kind of chunk the sports, right? There's rotational sports. So that's, tennis, volleyball, baseball, golf, right? Those are rotational based sports. They have different demands. And we have some field sports like football, soccer, even like maybe hockey would be in that group, right? Where it's, just a little bit different with how they do, You wouldn't train a hockey player like a soccer player, right? They may have a lot in common, but a couple of variables are so extremely different that you have to make that adjustment. I think it's the same thing, with baseball. So something to keep in mind. So I don't know if it's that there aren't good strength programs out there, or it's more that we're just stuck on the generic ones like Mike said. So nice. What else, Drew? We got one more?
We got one more. All right, long one. Tiffany from New York City. Hi, Mike. I attended your platform presentation at CSM. I appreciate the perspective you added in your discussion on a commonly missed presentation in fatigue pitchers that you labeled transient neurogenic fatigue. Can you provide more examples of cases you've had? Hopefully a new term catches on.
All right, so at Combined Sections meeting this year, the APTA meeting, we talked a little bit, we had a big kind of forum on baseball players, and we talked a little bit about how, at least at Champion, I think a lot of places out there, we've started identifying and treating thoracic outlet syndrome a little bit, and then we started to talk about how thoracic outlet syndrome is such like a big diagnosis, right? Vascular, neurogenic, there's all these things kind of put together, and how baseball players probably have like a unique variation of that. So we kind of came up with the term, we did this at CSM, just in the crowd, but we called it neurogenic, what did I call it again?
Transient
neurogenic fatigue, right? So we were going to say somebody give a TNF hashtag on Twitter, but not that Mike's on Twitter or anything.
I wouldn't see it.
But transient neurogenic fatigue, and the concept here is that what we found in baseball players is, look, if you look at their blood pressure, if you look at like their nerve firings before and after an outing, they're different afterwards. So the act of throwing a baseball puts so much stress on the body. The question is it just having this like microthoracic outlet syndrome like every time they throw? And eventually that becomes cumulative, or eventually becomes like a bigger deal at some time. But we started calling it transient neurogenic fatigue because we have a lot of our players, especially some of the older ones, they come to us like mid-season and they say, hey, my velo's down, I don't know why, I'm like a couple of ticks down on the radar gun, so I think I'm going to start long tossing again, right? If you Google how to get your velocity, it's like long toss, weighted balls, like all these sorts of things that are more of like development things. So if you're having a neurogenic fatigue from throwing too much, and then you Google how to gain velocity and it's more throwing, then it's going to be very counterproductive. And that's why we kind of can't try to come up with that term. So what are more examples to answer your question? I think, look, that's the person in season that's starting to have a tick down in their velocity. A person that's starting to just say like, I don't know, I just don't feel the ball. My breaking ball's not spinning well right there. I want to feel each one of those persons out and try to determine if it's more of a transient neurogenic fatigue now. And I think that's like kind of our first step. Because once you call a spade and you just admit it, you're going to change your programming, right? You're going to throw different in between. You're going to do a little bit less because you have a neurogenic fatigue. Right, so I think it just changes our approach. So I don't know if anybody has any other thoughts.
That basically sums it up, and I think it comes down to those are those episodes where the velo's down and you can somehow treat it. You give them a little rest, and then they come back somewhat quickly. It becomes full-blown TOS, thoracic outlet syndrome, if we still want to use that term, when they start having the yips and they're all over the place. And now that's probably too late. Now there's probably somewhat permanent damage, semi-permanent damage, if we can use the term semi-permanent, half-permanent damage to the nerve. And now
transient permanent.
Right, exactly. So now it's taken it way beyond. So those are the people that you tried to treat with some rest and some strengthening, whatever, and it's gone way too far now.
Yeah, I think we need to write like a current concept paper on this, on how it's, managing, maybe it's the concept of managing in season. So few physical therapists know how to manage baseball players or any athletes in season, right? Because that's not our world. That's not where we do it. So, it's a different type of thing. So, big topic, more to come, I think, down the road. But thank you for your questions on baseball. We love the baseball episodes. Dan loves it.
Yeah, I've been working my knuckleball. It's getting better.
And then I think you did a curveball.
You did a knuckleball.
What's that?
I think that was.
Sorry.
I would call that a curveball. Knuckleball, you do you do this. That's the signal for knuckleball. But thanks so much, guys. Head to MikeReinold.com. Click on that podcast link, and there's a nice form to fill out your questions. Getting tons of great questions still, so keep them coming. We love doing this. We'll keep the show going as long as there's questions in queue, so keep them coming. Head to iTunes, Spotify, rate, review, subscribe, and we'll see you guys on the next episode.